Healthcare consumers need and deserve accurate information about the quality and safety of the healthcare that they are receiving. This video is intended to help you sort through the available information about quality and safety to help you make better decisions about your healthcare.
Why is quality reporting important?
Patients need to know that the care that they're receiving is both of high quality and safe. The safety reportings help illuminate, the historic trend of a hospital and let people know how they have done in the past in regards to the quality and the safety and care provided.
Where does the quality information come from?
Most of the information that the major reporting and ranking groups use come from two sources. One is called MedPAR, and this is the billing information that we send in to Medicare. Every time a hospital sends a bill into Medicare, there's a number of things that are included along with the actual cost. This would include the patient's age, their gender, any other illnesses that the patient has in addition to what they were being treated for, where that patient ended up at the end of their hospital stay, whether they passed away during the stay, if there are any complications, and finally the cost of that care. All of that information is kept at Medicare and can be provided to the different rating agencies. There's another data subset called Hospital Compare. This is available to all of us on the CMS website. This contains information about the kind of care that people received and how good it was. So how good was the care for heart attacks or heart failure or pneumonia? What were mortality rates? What were readmission rates? How were things done in the emergency room? And some of the safety indices that Medicare keeps track of. All of this can be made available to the rating agencies to use in their reports.
How can we understand healthcare quality reporting?
There are a variety of different reports available to us right now. Some of the more common ones that we see are the Truven Healthcare Group, Care Checks, which is run by Comparian, Health Grades. All of these use those two data subsets, the CMS billing data and Hospitals Compare. Each of these different groups uses all or sometimes just a portion of those data sets. So they reflect different things. The more data that's used, the more complete the assessment of a hospital or a healthcare facility. Use of smaller amounts of data will give you a more limited approach. The next thing that these rating agencies will do is risk adjust the information. So they try and make adjustments in the data for how sick patients are. So facilities that are treating the sickest of the sick, the information is treated a little bit differently than perhaps a hospital who treats less sick patients. The other way that the data is somehow changed is what's called weighting. If you take a variety of different metrics, some are considered by different agencies to be more important than others. So they might put more weighting and emphasis on things like patient satisfaction, or they might choose readmissions, or they might choose mortality as being the most important. So you could take the same amount of information and depending on how you risk adjust it or how you weight that data, come to different conclusions about a facility.
What should consumers look for when reviewing quality ratings?
I think the most important things is a comprehensive view of a healthcare facility. The more metrics that a rating agency uses, the more complete that view. That's harder to do, so not every rating agency uses 3 or 4 or 5 or more metrics. Some only use 1 or 2, which gives you a less complete amount of information about a facility. So more metrics usually is a more complete picture of how a facility is doing. The other thing is to make sure that the metrics being used are the things that are most important to you. So if patient satisfaction is the most important thing in your mind, make sure that that's included in the rating. If cost or safety are the most important things to you, make sure that those are included in the ratings. Because if the rating agency is using something that's not the most important to you, then it's of less value.
Where does Mercy stand with quality ratings?
In the most comprehensive ratings, Mercy shows very well. We've been recognized as being top 100 hospital. We've been recognized as being in the top 10% in the nation by some of the more comprehensive rating agencies. But it is a mixed picture. Again, depending on which metrics might be used and how they're risk adjusted and how they're weighting, Sometimes Mercy does not show up so good in certain ratings. Again, picking a comprehensive source that looks at a variety of metrics about a given hospital is the best way to assure that what is important to you shows up in those ratings. And in those comprehensive pictures, Mercy shows up very, very well. To learn more about Mercy's quality information and the programs that we use to promote our quality, I would invite you to view our website at www.mercycare.org/quality.